Medical virtual assistants, what are the most common tasks that a medical virtual assistant is doing, and who can start working as a medical virtual assistant today? So in answering this question, allow me to start with the who first. There are, I think, two groups of people that are perfect for medical virtual assistants. And these are, number one, the medical professionals, nurses, those in the medical technology, pharmacists, doctors, anybody in the medical field, because they understand processes from admitting or patient intake to credentialing or to the billing processes. Okay. So they understand, what happens in between and the different terminologies, the jargons, there are also codes. So they're perfect for medical coding. They're perfect for more of the customer service. They are perfect, on those types of tasks. There are also another group of people, that the second group of people that can work as a medical virtual assistant. And these are non-medical professionals. And these MedVAs, may just need some training. Actually, everybody needs training in order to familiarize the processes in the online freelancing medical virtual assistants. But the second group can focus on the administrative, marketing, and the virtual assistant customer service part. So they would do calls, email management, project management, posting in social media, maybe a little bit of bookkeeping. And I think the number one task there is going to be on the customer service in relation to calling, setting appointments, scheduling, and at the same time would serve as the admin / receptionist online for the medical clinics, institutions, or medical professionals. Now, for the second part on what are the tasks, these are listed here. The most common ones are listed here in our masterclass medical virtual assistants, because these are the very tasks that were communicated to us by our hiring VA partners and the ones that we have researched in different platforms and those that are posting online. So one there, if you can see, is, credentialing, patient intake. Okay, there's patient intake there. What are the processes in credentialing? Credentialing is basically getting information and licenses of doctors, medical professionals that would be serving in certain hospitals or clinics. Patient intake, there's a form there. There are processes there. There are also email management. Okay, this one is EMR. So it's basically putting records, managing records for patients, calendar management or appointment setting. There's also the insurance verification part, okay, calendar management. There's also appointment setting. There's also telehealth or remote patient care, right? So this actually covers, monitoring if they have, like, for example, a monitoring band or apparatus, and that's actually being monitored by a medical virtual assistant. Though the first one, the first group that are medical professionals, okay, BP, glucose, okay, a heart rate. There is also the, if we can see your transcription, okay, there's also billing and coding, availability, so who can avail of the insurances. There's even transcription, all right, here. Also, the refills, okay, if like the hospital or clinics are needing lab, equipments or medicines, okay, clearinghouse, billing, okay, denials. This is more on the billing and coding and, in relation to insurances. Now, know that there are clients that will hire you for specific tasks. It might be that they will need you to assist them with remote patient care, or maybe just on insurances, maybe on the appointment setting, calendar management, or groups of tasks or lumps of tasks. Okay, maybe more on the administrative side that will cover your email management, calendar management, appointment setting, social media, or maybe all of the things that were covered. So just be ready. That's why a training is very much needed. We are, of course, providing these in our Surge training centers, in our online courses as well. So go ahead and find us in different social media sites and enroll today. Thank you so much for watching. God bless you today.